So I've been interested in staph infections since I was a fellow. It always amazed me that of all the advances we've had in science, kids in the neonatal intensive care unit or the NICU still die of invasive Staph aureus infections. This is a bacteria we've known about for over 100 years. It was reported to cause outbreaks in the 1800s in the medical literature, and I remember seeing my first case of a vulnerable infant that was admitted to our intensive care unit, unrelated to bacterial infection, and then wound up succumbing to this bacterial infection. And I thought to myself, gosh, it's a bug we know how to kill. We know where on the body it lives. How come we're not able to do more to protect kids from these invasive infections and life-threatening infections? About a decade ago, we worked with a national data warehouse and described the burden of invasive Staph aureus infections in infants in the ICU. At that time, we also looked at the overall mortality. Many studies in babies look at overall mortality, which is a marker of how often do kids die. You might know the child had a staph infection, but sometimes babies will have staph infections and they may survive and live in the NICU for months after that and go home. Some kids may survive that infection, but go on to die later from another illness like chronic lung disease. So one of the things we were really interested in this study was looking back over the last 5 years and comparing what we found now to the data we had from 10 years ago. We wanted to see, given our advances and some of the programs that have been put in place, have we done a better job protecting babies from these staph infections? Are they still impactful? And how often do kids die from these infections in the NICU? And not just how often do these kids that get them die, but how often did they die? And do we think it's as a result of that specific infection? So part of what we did in this study was we carefully identified kids who had infections. These were bloodstream infections or other invasive infections. And we looked to see how often they died within 7 days of that infection. So we had dated data, like data with dates. So we could say if a child died within 7 days of the infection, we made an assumption that those two were likely related. Obviously, if a child dies a month or two after the infection, it's possible it's related, but it might be also related to other things. So for this study, we really focused on kids that died within 7 days. And what really struck me about the study was not just how commonly this is happening in babies, but how commonly it's happening in very low birth weight babies. These are our most vulnerable babies, the babies that are born less than 1,500 grams. 2% of babies born less than 1,500 grams have an invasive Staph aureus infection. And this was in this group of about 500,000 kids. So within these 500,000 kids, about 2% of them had an invasive Staph aureus infection if they were born less than 1,500 grams. That is more frequent than most any other complication we see in these kids. So I was trying to contextualize that for myself, and I went back and looked at so you may remember that over 20 years ago, one of the most common causes of infections in babies was a common strep bacteria called group B strep. The incidence at the time was 2 per 1,000. So every 2 in 1,000 babies that were born had an invasive group B strep infection. And it was such a problem that a national surveillance program went in. This program where moms, when they're pregnant, are screened to identify those with group B strep, and they're given an antibiotic at the time of delivery in hopes of preventing the baby from getting this bacteria and dying or getting sick from that bacteria. And we put that program into place, or that program was put into place at the time when the incidence of infection was 2 per 1,000. So 2 in every 1,000 kids. And of the kids that got sick, about 5% of them died. What we found in our current study is that for Staph aureus, in low birth weight kids, which is a much smaller population, 2 per 100 kids are getting this infection, and more than 5% are dying. So this bacterial infection in these, especially low birth weight babies, is 10 times more common than group B strep was, and the mortality associated with it is similar, if not even higher. So it just shows that this is still, it's a smaller population because it's not every baby, but it's babies that are born premature and born into the neonatal intensive care unit. Their risks of getting this common in bacteria and getting infected with it remain high, and it puts them at lots of risks.